All right, well, there's a new running trend that's all about a little bit less when we're talking about it. We have Dr. Sarah Spizzirri here from Christie Clinic to tell us a little bit more about it. And you've brought kind of the quintessential example. We're talking about running barefoot or running in a minimalist shoe. This is something you said you've gotten a lot of questions about lately.
Yeah, it's really become quite the rage in the last few years. It's nothing new. It's been around really only in the past 30 to 40 years have we seen the development of a traditional running shoe. So prior to that time, most people did run with really a minimalist shoe or even barefoot.
So what's kind of the first thing you advise people when they say, hey, I'm trying to find out a little bit more about this, I'm thinking I might get into it?
The main thing I always tell people, first of all, is to know your limitations. Make sure there's no health conditions that you really should watch out for. My patients with diabetes, neuropathy or numbness in the feet, anybody with osteoporosis, or anybody who has any really significant foot, ankle injuries that really require bracing or orthotics, we usually recommend frowning upon barefoot running.
So tell me the difference between what a traditional running shoe is and what like a minimalist shoe provides, or and then compare it to barefoot as well.
So usually we recommend if you're thinking about running barefoot, first start with a minimalist shoe. It's a nice transition between your traditional running shoe into that complete nothingness. So for a barefoot shoe really is just a glove for your foot. It's very flexible. It's really not going to give you any support or structure, which is completely different than a traditional running shoe, which really has a significant last in it to maintain stability within the rear foot and the arch. Okay. And they're also very light, as you can tell.
Yeah, I was going to say these are
this is just one example of one, and then also a lot of people do know the 5-finger shoe as well.
That's right. And so what are you going to find more in a traditional running shoe? Just a lot more support, or is it?
Yeah, mainly it's a lot more support. As you can see with this shoe, it's extremely flexible. It bends basically into a ball, whereas you compare a traditional running shoe, you get no movement in the rear foot or arch. It's only a bend in the forefoot.
Okay.
So really this shoe is meant to try to control the rear foot, which in turn we think controls the rest of the foot.
Now, some of the runners we talked to, they said that they thought barefoot running was actually helping to kind of keep some of their injuries at bay. Is that something you find, or are there specific injuries that could go along with barefoot running? So
the jury's really still out on that. The literature is really mixed on it at this point. We do see a lot of people saying there is decreased stress and strain in the legs with running barefoot. Really the whole gait and structure of the body and biomechanics do change when you run barefoot. You see several things. First of all, when you're running in a traditional shoe, most of us hit with our heel first. As you transition into a barefoot or minimalist shoe, your weight will transition to hit the ground with the forefoot first.
Okay.
This in turn decreases range of motion of your knees and hips, which is thought to reduce stress. And also you'll notice people that do run barefoot or a minimalist shoe have a much straighter upright posture. Most of us that run traditional shoes tend to lean a little bit forward. So it's thought that if you do it safely and you're the right person for it, that it can be done safely with the hope of not increasing your risk of injury.
Can you show us maybe on the model just some of the things or some of the parts of the foot you want to watch out for?
Sure, several things. The main thing we worry about with barefoot running is stress fractures. We traditionally see these in the metatarsal bones of the foot.
And those are for, I mean, any runner gets
exactly.
those.
I mean, any athlete,
right there too.
Even anybody who's on their feet for work or anything like that can see stress fractures of the metatarsals. And that traditionally will start with pain in the front of the foot, swelling, usually very isolated pain that you can pinpoint. That's one of the most common things we do see if this is done incorrectly or done too quickly. And then the other thing that can happen is you can get some tendon and ligament issues within the foot if you're not properly stretching prior to running.
Okay. So
not only the muscles in the bottom of the foot, but also the muscles that come up through the ankle and into the calf.
Okay. So what's your takeaway message? If I said, you know, I'm really thinking about this, you know, doctor, what advice can you give me? What would you say to a patient?
I usually say start slow. We usually recommend the 10% rule. So whatever your normal mileage is, you start at 10% of that in a minimalist shoe. And you do that every other day for about 2 to 3 weeks. After that, every week you can gradually increase by 10%. If you have a lot of pain, slow down, maybe stop for a while and then transition back. And then definitely make sure you're stretching aggressively about 15 minutes before and after.
Okay. Well, thanks so much for joining us and telling us all about these barefoot running and the new trend. We certainly appreciate it. And how can people get in contact with you if they'd like to learn more?
They can contact us at Christie Clinic, and I'm in the podiatry department.
Okay, wonderful. We'll be right back.